We've heard of a urinary tract infection or UTI because it's common. It happens when your urinary system gets infected. That means your kidneys, ureters, bladder, and/or urethra. Women have higher chances of getting them. And in men, it's about a 1 in 10 chance that a man will get UTI in their lifetime. But the more we know, the easier and sooner it will be to manage and prevent it. I'm Dr. Freddy Gomez. This is MedTalk Health Talk, your connection to healthcare. We want to first talk about our kidneys. We have 2 of them, but we can survive with only 1. And your kidneys filter your blood, creating urine as a waste byproduct. It then travels through the ureters to the bladder, where it is temporarily stored. Anything that affects the urinary tract and its function is a urinary tract disorder. Our guests are here today to help us understand this better. With us is Dr. Steven Nazareth. He practices urology at the Makati Medical Center. We're also joined by Dr. Jose Marcia. He's the head of the nephrology section at St. Luke's Medical Center, Global City. It's glad to have both of you on the show. Thank you for joining us. First and foremost, what are some of the examples of a urinary disorder?
Simple layman's term, they always think that it's as common as a cystitis, where in fact, anywhere along the urinary system, you can have an infection. Usually, this is subdivided into the upper tract and the lower tract. Depends on what it is that is affected. So usually if it's the upper tract, patients do develop fever and then flank pains, pain on their side. Whereas if it's the lower tract, they usually complain of pain during urination.
Now, chances are you've experienced having a urinary tract infection. It's among the top leading causes of morbidity in the Philippines. And it's also very common in women, occurring in 1 out of 5 women in their lifetime. For men, it's about 1 in 10. Now, Dr. Steve, why is this the case? At ano ang mga main causes ng UTI? At bakit mga babae ang mas nagiging susceptible dito?
If women during their adulthood, they're more prone to UTI because their urethra is actually near the vagina and the colon, so rectum. So they can easily, the bacteria can easily travel from one point to the next. Now the role becomes reversed when men gets older, simply because the prostate becomes the most common cause of UTI. So usually UTI becomes more common in men 60 and above.
Okay, that's good to know. Now, Dr. Steve, itong importante naman, what are the symptoms that our viewers should look out for if they want to think that they have UTI?
All right. Most common is pain during urination. Usually, you would ask what part of urination is more painful. It's toward the end of urination. It's not really yung umpisa. Or sometimes it's all throughout, from the beginning to the end. But more commonly, it's toward the end. Parang biglang may tingling sensation when they're about to finish the urination. And then, of course, mas delikado if the patient now develops fever. That's an entirely different thing. It is still considered infection, but that one might need hospitalization, especially if the patient can no longer eat or feels really weak.
Now, Dr. Marcia, what are some of the standard tests in order to diagnose someone of having UTI?
So the most common would be a urinalysis. So we're looking at the WBC and the bacteria. We're looking at some would be positive in the leukocyte and nitrate. But the gold standard is still culture of the urine. We're trying to grow the bacteria that's present in the urinary tract. There is an sensitivity for the antibiotic. It is to let which organism is in the bacteria and what antibiotic will respond to the organism. But if it's recurrent, we should also look for other causes. There might be an anatomical cause, so we need to do a CT scan or an ultrasound just to rule out if there are stones or doubling of the ureters or if there is another anatomical abnormality.
That's right, Dr. Marcia. No? So all those tests that you mentioned, kung may ultrasound, ito yung pag hindi nag-resolve yung kanilang UTI after a few days, which it generally does. Now, Dr. Marcia, a key point also here is a lot of people know what a urinalysis is, but there is a way in order to properly give that specimen para yung mga doctors will get a very good representation ng kanilang urine. And that's what's called a midstream clean catch. Could you explain this a little bit more?
So urine is basically sterile. It means that urine has no bacteria, so it's void of any organism. So to prevent contamination, we tell our patients that to collect the urine midstream, it means after voiding a few urine, they will collect it during the midstream of their urine.
That's right, and one of the main concerns a lot of people suffering from UTI has is the discomfort it poses. And thankfully, there are ways that we can prevent infection altogether. Dr. Steve, what are some of the practical ways in order for someone can prevent having a urinary tract infection?
Basic really is to drink a lot of water. Kasi we tend to forget about the importance of drinking fluid. The less fluid we take, the more concentrated the urine, the lesser yung paglabas niya in our system. So it stays in our body longer, so the chance of you having infection is really higher.
And when you have a kidney disorder or disease, it may mean that your kidneys are unable to filter out wastes. And that can lead to a number of problems. We'll talk about those kidney problems and disorders after the break. You're watching Med Talk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk on CNN Philippines. We're born with two kidneys at our back, located just above our waist. And their job is to filter waste products, excess water, and other impurities out of your blood. Now, when the kidneys are damaged, the waste products and fluid can build up in our body. And this can cause several symptoms, such as maybe swelling in the ankles, or even sometimes dizziness or nausea. Now, when that happens, you will then suffer from different types of possible kidney diseases. Now, I'll go with Dr. Marcia first. Can you explain to our viewers what happens when you have chronic kidney disease?
The kidneys are not functioning well. It's less than 60 ml per minute. It's like the car. Car can run, for example, 80 to 120 kilometers per hour. Our kidneys will run at 80 to 120 ml per minute. So if there is decreased function less than 60 ml per minute for more than 3 months, it means that the kidneys are not functioning. So in our kidneys, if it's damaged, even if you drink a little, it will just remain in your body. So there is volume overload. It means that the excess fluid cannot be removed by the kidneys. So you will have water in your lungs, you will have water in your lower extremities. So that's dangerous also.
That's good to know, Dr. Marcia. Now, another common kidney disease as well is or are kidney stones. Dr. Steve, could you please explain to our viewers what are kidney stones? Marami ring mga viewers natin ang nagtatanong tungkol dito.
Yeah, one of the more common consults that I do get are kidney stones. Now, kasi we do form sand in our urine. Now, the problem is if this accumulates slowly, it builds up and forms into stones. Now, sometimes it stays in the kidneys, but other times it travels down. The problem is if it causes an obstruction along the urinary system, which can actually cause pain, severe pain on your side. It depends on what part is affected, either the left or the right side. This pain you will never forget. I mean, it's extremely painful. The patients feel like it's the end of them. That's how severely painful it is. This is because the flow of urine on that particular side of the kidney is affected, causing that kidney to swell up and thus causing pain.
Now, Dr. Steve, a follow-up question to that. How can people prevent kidney stones? What can they do?
Of course, like I told you before, increase your water intake. At least 2.5 to 3 liters of water every day can help flush out that kidney stones. And then, of course, you need to have an active a life. Okay, you cannot be just sitting around and hoping for the stone to pass out. You have to be physically active, and of course, you should watch out your diet plays also a role. Try to lessen your uric acid intake, your salt intake, and soda.
Now I'd like to go to Dr. Marcia for a second. There are factors that can make a person more vulnerable to kidney diseases. Dr. Marcia, could you share with our viewers what are some of these risk factors that they should watch out for?
The most common cause of renal failure worldwide would be diabetes. So diabetes and hypertension. But if you control the blood pressure and you control the blood sugar, you can prevent kidney disease. So remember, there are risk factors, but you can prevent them.
Going back to Dr. Steve, could you share with our viewers some of warning signs of kidney diseases? Biglaan lang ba minsan nangyayari ang mga pain na nararamdaman, or can the viewers point out or feel things in themselves that can make them think that they're having a kidney disorder, kidney disease?
Well, if you're talking about UTI or pain because of stones, these happen suddenly. 1 minute you're well, the next minute you're in pain. Either pain on your side, or when you urinate, it's painful. There's no warning sign when it comes to these things. But some, especially for those who have already experienced kidney pain, they would notice that slowly it would appear that there was like an aching feeling on their side.
Can this be treated with medical intervention purely? Or is there a point where surgical intervention might be needed?
There are several factors that we need to consider. How big is the stone, the location of the stone, and if it involves one or two kidneys both at the same time. Normally, stones less than 6 millimeters can be treated medically. Okay? We can maximize it for as long as the patient, we are able to control the pain and the patient does not have infection. And of course, if the kidney function is not affected also.
We'll be talking about diagnosing and treating kidney diseases next. Keep it right here on MedTalk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez, and we want to be your partner for a lifetime of good health. Our kidneys are essential to having a healthy body, and if damaged, your kidneys can no longer function efficiently, filtering out blood, and this can cause problems even with your blood pressure. And so it's vital to seek treatment right away if you feel signs and symptoms. And without treatment, the damage will get worse, and your kidneys may even stop working. Remember, this is why it's very vital, so vital, to seek consultation right away. Now, continuing the discussion with Dr. Marcia, could you take us through treating various kidney diseases?
Kidney is an all or none function. My example would be a light bulb. So in terms of function, a light bulb, it's either light or busted. Kidneys are also like that. Even in staging 1 to 4, the kidney could still sustain life. But if it is severely damaged, it can no longer filter waste product. It cannot remove excess fluid. It cannot control removal of acid, and the electrolytes will just accumulate. It's really shutting down. I have one patient. We removed 2 kidneys. We did dialysis for 3 months. Then we placed a kidney, so she underwent a transplant. She's living right now for 7 more years. In the kidney disease, there's still hope even though the kidneys are not functioning. If we're going to talk about the treatment, the best treatment will still be prevention. So what does that mean? If you're having diabetes, you control your sugar. If you are hypertensive, you lower down your blood pressure to normal. Then our advice for diet, it's a low protein diet. So you need to eat more of the fish and vegetables. You shy away from red meat, the beef and pork. You lessen also salt. You drink a lot of water. You try to urinate and not withhold your urine, and have a regular checkup. But the worst case scenario would be a damaged kidney. So that is not functioning, that cannot sustain life. So that's the time you need a renal replacement therapy. So what are the renal replacement therapy? There are two forms, the dialysis and the transplant. The transplant is the best mode of renal replacement therapy. So you will get you will get a kidney from a donor and it will be placed to you. So you will have 3 kidneys. It will function like a normal kidney.
Dr. Steve, what are some of the food that people should avoid in order to avoid these kidney problems, such as kidney stones or even chronic kidney diseases?
One, stay away from salty food. That is very important. And then if you're a meat person, kind of lower down your meat intake as well. Okay? Like we say, any meat that walks on 4 legs, try to avoid them. Now, if you're talking about fish, fresh water is better than salt water because we are trying to avoid also too much uric acid intake, especially if you like tuna or salmon and sardines. These are high in uric acid. Even the shelled fish, prawns, clams. Okay, if there's a need for you to take them, just enough for you to actually not to forget the taste, but not indulge. And even the beans and bean products, all these are rich in uric acid. Those are practical things that can be done. Once you're a stone former, you're always a stone former. But at least we can decrease the chance of recurrence if you follow these instructions.
Dr. Steve, since we're on the topic of food and what to eat or drink, a lot of Filipinos follow or believe that coconut water, buko juice, is something to take, something to drink in order to prevent or when they have some problems with the kidneys. How beneficial is this? Is buko juice, coconut water, better than water?
Okay, so it's more palatable, but in reality, it's still just water. But it does contain a little bit of citrate. Now, citrate can actually decrease the stone size. It helps dissolve the stone, but this is not as much. If we really want the highest concentration of citrate in the juice, it's actually lemon. It has the highest citrate content, but buko is readily available. We can have it, and it increases your water intake. It's fluid intake. So it does help in that sense.
Very good advice. And with that, I'd like to thank our guests for today, urologist Dr. Steven Nazareth and nephrologist Dr. Jose Marcia. I'm Dr. Freddy Gomez, and on MedTalk Health Talk, we bring you the knowledge and care you need, especially in this time of COVID-19. We'll see you again next time. Stay safe and be well.